And I would like to call Meghana from third year.
Good afternoon, everyone, respected dignitaries, and my dear friends. I am Meghna, studying B Pharmacy third year. So today I'm here to create an awareness about the cancer. Okay, let me start like this. How do you feel when you cough with blood? How do you feel when your beautiful hair no longer remains on your head? And how do you feel when your beautiful hair no longer remains on your head? Yes, that's exactly how a cancer patient feels like. Now, what is cancer? By now, you might have mugged it up, right? The unrestricted or the uncontrollable growth of cells in our body. We have cells and cells, over 100 billions of cells. Yes? So, in everybody's body, there are cancerous cells. But when they get focused and organized in a particular place, then it will lead to cancer. There are different types of cancers. But 5 out of every 10 women are at a risk of getting breast cancer due to lack of awareness. That's because people are embarrassed and shy away to talk about it. And that's when I decided to create an awareness about the breast cancer. Now, coming to the causes of breast cancer. It's not like some climatic change occurs externally and you undergo breast cancer. No, right? It may include the factors that you can't change, like age, genes, early menstruation, and late menopause. Other factors include drinking, smoking, obesity, hormonal therapies, and the most basic and unknown factor includes wearing the incorrect size of your inners. Yes, you heard me right. It will also lead to the lump formation in the breast. So be careful the next time you choose it. Now, coming to the symptoms of breast cancer. What might be the symptoms of breast cancer? 1. A lump formation in the breast. And 2. Change in the size of breast. And 3. Any abnormal discharge from your nipple. Now, a question may be arising from you guys. How to detect it? The detection may be done by ultrasounds, mammography, clinical examination, and fourth one, self-breast examination. Now today my topic will be limited to self-breast examination because most of the people are unaware of it, and my main motive is to provide an awareness in such a way that even the non-medicos, non-health professionals and illiterate women also understand it, and which is of cost free. So while doing your self-breast examination, always remember your A, B and C. A for armpit, B for breast and C for the clavicle or the collarbone. Every time or every month you do your self-breast examination, always remember you are a superwoman. That's how we are going to remember our 3 bosses. And it should be done after 1 week of your periods because there will be no influence of hormones on your breasts. For the first pose, you are a standard superwoman. Ready? So take your hands, put it on the waist and breast out, and look for any abnormal changes in the shape, size and texture. And if you find your nipple inverted or retracted, and if your skin on the breast looks like an orange peel, that's nothing but dimpling of the skin, then that can be an alarming sign of breast cancer. For the second pose, the superwoman takes a flight. So lift your left hand up and with the 3 fingers on your right hand, examine your A, B and C. The armpit, the entire surface of the breast and the clavicle or the collarbone. If you find any lump in any of the 3 areas and which is not painful, then that can be an alarming sign of your breast cancer. In the third pose, look for any abnormal discharge from your nipple. If yes, you need to rush to your doctor. And that's it, guys. You're done with your self-breast examination. So it is designed in such a way that even the non-medicos and non-health professionals would understand it and also of cost free. So spreading awareness is not in a way that coming in an elocution, talking, winning a prize, clapping. No. I contributed myself by teaching this to my mother, my sisters, and women in my circle. So I hope you do the same thing. And all these people have told you to eat right diet, vegetables, green leafy vegetables, etc., etc., exercise, yoga, etc. But we can only tell you. It's all in your hands to take care of your own body. In the Mahabharata, when Arjuna asked for a advice from Krishna, Krishna said, I will only sit in the chariot and will guide you. So, I'll just conclude with one sentence. So, in the Mahabharata, when Arjuna asked for an advice from Krishna, Krishna said, I will only sit in the chariot and will guide you. But it's you who have to take care of your own body. In the same way, it's you who have to take care of your own body. And just like I mentioned earlier, the crime flourishes when there is no order in the system. Right? What's the system here? What does it explain? It explains that when there is no order in your body, then it can lead to cancer. So it's your responsibility to take care of your own body. Thank you for giving me this wonderful opportunity, and thank you everyone for paying attention to my words. Thank you.
Thank you. Now I'd like to call Indumati from third year.